So, quick break from the music. We're doing challenge 1, protect the vulnerable populations. We propose actually starting with identifying who, why and when to test, so effectively identifying the most at-risk patients. We'll review the current genetic database to predict the number of at-risk patients in Australia and then be able to advise governments on the likely comorbidities and risks. Identify all the Australians with positive COVID-19 diagnosis, about 6,500 at the moment, and either use their existing genetic tests if they've got them or take one. And we propose a study afterwards. Then we'll protect the vulnerable populations we identified by stratifying them into low, medium and high risk. We would take those learnings to remote areas using telehealth and then expand and improve access to education, because all of those resources will of course be digital. Here's the overall plan, but more on that later. Another break from the music. This is the overall project plan, initially to advise health authorities on likely disease impacts for planning purposes, primarily using known information, identifying at-risk patients to test and or isolate using newly acquired genetic information, then use all of that to raise the level of COVID-19 education primarily through digital resources, and then, because that's digital, extend to remote and regional patients, and finally to use all those information to plan a larger study. Initially, the advising health authorities would review the published risk factors of COVID-19 infection. We've done that already, or started to. Then literature search to identify the genetic variations or errors that lead to that, and then review the Australian commercial genetic testing data. And then estimate the treatment for ventilators and other equipment, ICU admissions and so on. Secondly, to identify at-risk patients to test and isolate. This would be a small study with the known COVID-19 infections in Australia, and then correlate that with immunity genetics we've previously provided, and then stratify the population by risk to better target. There's some number crunching in there to get some algorithms to identify those people, identify those patients suitable for more stringent social distancing or priority vaccination when it's available, or interventions when they're available. Push that information out through education resources to the public and to practitioners, and because all of that's digital, extend it to remote patient triage and remote practitioners, and use all that information for a clinical trial to really validate this, and also find interventions that work, so interventions like lifestyle, food and so on, and nutrition. Push that back into the e-health platforms and for the at-risk patients. There are obviously issues or risks with a project like this. There's already competition. All that does is demonstrates to us it's a good idea, and there's an opportunity for collaboration and funding. We also incorporate preventative interventions from 10 years of practitioner experience. Privacy is an issue for a couple of reasons. Making sure people have up-to-date data security is important, but also accessing the existing COVID-19 diagnoses. We'll need some computing capacity with large data sets to crunch, and that's probably expensive, so we'll seek some involvement from the large computing providers. And the Therapeutic Goods Administration tends to frown on algorithms, but it's a research project, so we should be fine.